of healthcare heroes at Clovis Community is implementing technology that allows patients to become more involved in their healing process. The Clinical Informatics team with Community Health System is one that you might not always see in the patient's rooms or by a patient's bedside.
So we work with the nursing areas, the clinical areas, and IT to kind of develop and operationalize a lot of the technology that we implement around the system.
Kevin Barcelos is the Director of Clinical Informatics with Community Medical Centers and has played a part to a groundbreaking innovation to evolving patient care.
Often when we implement technology, it's not just taking the process that we did on paper or prior to the technology ahead of time. It's looking at workflows, it's looking at processes, understanding what the staff are doing and taking that into account as we implement the new technology.
The informatics team implements those new developments by working closely with other areas of the hospital to coordinate education for the staff.
Oftentimes there's a translation between what might be needed for patients or on the operational and nurse side onto the IT side. So we have to kind of be that in between to take what might be needed, use our sort of analytical skills to interpret that for what we need to do in the software so that the end result is something that they actually can see and use and work with.
Most recently, the patient portal of MyChart has undergone a transformation by bringing bedside care to patients at Clovis Community.
MyChart previously was really focused on the outpatient setting. So when I'm going to see my doctor, when I'm going to see a specialist, that was really the focus. Now, while they're in the hospital, it brings some of the same technology.
This technology, MyChart Bedside, grants extended capabilities that serve not only the patient and their experience at Clovis Community, but creates a better workflow for nurses and clinicians as well.
The nurses are assigning education and then the patient can view it in MyChart Bedside. The patient can make simple requests. So rather than pushing the call light and asking someone to bring them a warm blanket or a cup of ice, they actually, from their tablet, can say, I want a warm blanket, and the staff get a message and know exactly what that patient wants.
And this really allows the patient to see all the information that's put in their chart. They can see their vital signs real time, their medications, physician's notes.
Working to help implement this technology as well as other essential tools, the informatics team plays a critical role in patient care.
We've been able to really experience and see how technology can offer positive benefit.
And I love the fact that we're giving patients the tools to be more involved in their care and take an active role in their healing and in their disease process.